In this video, I will be discussing the disease known as hypertension. I will be covering the definition of hypertension, factors that cause hypertension, the effects that hypertension has on the body, and the relationship between hypertension and heart disease. In the next few slides, you will be presented with a few questions. These will be used to see how much you currently know about hypertension. Please answer each to the best of your ability, as there are no wrong or right answers. Do you know what hypertension is? Yes, some, or no? Do you know what causes hypertension? Foods with a lot of salt or fat, little physical activity, other health problems, all of these, or none of these? What organ in the body does hypertension affect the most? The lungs, the heart, the kidneys, or the brain? Hypertension is another name for high blood pressure. Blood pressure is the strength of blood pushing on your blood vessel walls. Vessels are what carry blood throughout the body. High blood pressure is when the strength of blood pushing against the walls of your vessels is too high. Typically, a blood pressure reading of 140/90 or higher means that someone has hypertension. Causes of hypertension include other health problems such as diabetes and obesity, genetics, a high consumption of foods with a lot of salt or fat, such as fried foods, as well as a low amount of exercise or physical activity. High blood pressure puts stress on the heart and blood vessels and causes them to weaken. It can also damage tissues inside arteries, which are the type of blood vessel that carries blood away from the heart. This damage allows plaque to build up on artery walls. The more plaque in the arteries, the smaller the inside of the arteries will become. Plaque is made up of fat, cholesterol, calcium, and other substances in the blood, and it hardens over time. Blood pressure allows plaque to build up, but the buildup of plaque also causes your blood pressure to stay high. Hypertension, or high blood pressure, is a type of heart disease. It can lead to coronary artery disease, which is the name for the plaque buildup we talked about in the previous slide. That plaque buildup can lead to other types of heart disease like heart attack, stroke, and a fast, slow, or irregular heartbeat. In summary, we have learned in this session that hypertension is a consistently high force of blood pressing against vessel walls. Causes of hypertension include a diet high in salt and fat, small amounts of exercise, as well as other health problems and genetics. Hypertension affects the body by weakening the heart and blood vessels and damaging tissues, allowing plaque to settle in arteries. And hypertension is a type of heart disease that can lead to more serious forms of heart disease if it is not treated.